So welcome back to the second part of our online symposium, Women and Sports. We thanks again our sponsors that help us realize this event. We have some exciting speakers again this afternoon with us, Jane, Kari, Ollie, Karen, and Sarah. Then I would like to remind you that on our YouTube channel, you can watch two presentations by Sarah Duval and by Monica Leiner. This is free online access that we offer you. We would like also to acknowledge our partner journals, BGSM and JOSPT. Our members have free access to these journals. Then just a reminder for some conferences upcoming, the IOC World Conference on Prevention and Injury in Injuries in Sports next week in Monaco. Then our partner conference, Football Medicine, next year in Lyon, France. And then, as Suzanne has already shown, there will be the 4th World Congress of Sports Physical Therapy next August in Nyborg, Denmark. So, and now it's my great pleasure to introduce our first speaker of the afternoon, Dr. Jane Thornton. Jane, first I will tell something that you are, but a rower, an athlete, so world champion, Commonwealth champion, Olympian. Unfortunately, the leather medal, I think, 4th place, somewhere I read. And she's one of the BGSM editor. And now you correct me, you are the Canada Research Chair in Injury Prevention and Physical Activity for Health at the University of Western Ontario, Canada. And she is very active, everything regarding physical activity, health, and more. And I will stop here. I also read that you did a residency in Switzerland many years ago. Maybe you can say something. And otherwise, we are happy to listen to your presentation. Many thanks. Grazie mille for you being with us today. Please.
Thank you so much, Mario. I did spend a year of residency in Switzerland, in Lausanne, and I loved every minute. Je vais éviter de faire cette présentation dans mon accent charmant acadien. And I will also, estoy imparando ancora italiano, allora en mein Deutsch, ich bin nicht gut. So today's presentation is going to be entirely in English, and I've yet to learn a word of Romansh, and I would love to at some point. But I wanted to, I'll just share my screen in terms of, and get the presentation started. And it's thrilling to be with you today. Of course, I'd love to be there in person, but it's amazing to be able to share this presentation with you from afar. And I hope to see many of you at future conferences. I want to thank you for that kind introduction, Mario, and what I hope to provide over the next 20 minutes or so is an overview of female athlete health and health considerations. Not to be diving so much into specific types of illness or injury, as many will be covered by my brilliant colleagues today and have been already. I was up very early this morning to hear my colleagues, Joanne Camp, Andrea Moser, and Kay Crossley present wonderful research about really their dream team of work. And I know that my colleagues in Switzerland Okay, sorry, I think the internet cut off a little bit. Does it, hopefully everyone's okay seeing me now? I'm gonna continue, assuming that everyone can see me, but let me know. So what I'd like to do is talk about some of over the last 20 years of research, lived experience that's shaped my own clinical management of female athletes, and perhaps provide some tools for your care of female athletes in the future. So I have a couple of disclosures, as we mentioned already. I'm an editor of the British Journal of Sports Medicine. The editor-in-chief is Dr. John Dresner, as you know. Canada Research Chair in Injury Prevention and Physical Activity for Health. So I do get some funding from the federal government for the research that I do. And I'm also a board member of Rowing Canada. And so I apologize for that icon. There wasn't anything that came closer to rowing. So I want to start with this quote that we cannot change what we can't measure. And this has been attributed to several people, Peter Drucker among them, a kind of a management guru. But you've probably heard this quote many times before as it relates to injury prevention and sport and exercise medicine. But in order to make an impact on health outcomes.
Jane, do you hear me?
Yes.
Maybe the technicians, they tell me if you can switch off your camera, then maybe it's because of the bandwidth.
Yes, will do. Okay. Hopefully everyone can hear me better now. And
Thank you.
Let me know. Perfect. Thank you. So, so it doesn't mean that, basically it's imperative that we measure health outcomes in the first place. And there's been a recent increase in female athlete health research, although a large data gap remains and it's existed for far too long. In this case, it's probably really about we can't change what we don't measure. And it doesn't mean that we have to medicalize female athlete health and make everything condition. In fact, I would say let's lean the other way, but really there are considerations that can shape injury and illness experience, prevention and treatment to maximize overall health over the course of a female athlete lifespan. So the objectives of today are really to look at three things: to understand health considerations across the lifespan, to recognize various presentations of health challenges and conditions in the female athlete, and understand some of the research gaps that are existing in female athlete health. So I'm going to provide an overview of health first and how considerations, not conditions, across the female athlete lifespan may play a role in how you can treat and manage injuries and illness, as you may be the first or main contact for athletes in a clinic on a team. I'm going to have references at the end of the slide, but also put them on Twitter at the end of the presentation to show you some other places to look for research in this space. So I really like this approach for the study of the female athlete from the challenge of applying and undertaking research in female athlete sport. Basically, we're taking the current evidence base, we apply it against known biological differences between male and female athletes, and then we apply the female sport environment. So we can think of different pertinent examples, such as Dr. Steph Cohen's and Cherie Becker's research on ACL injuries, for example, that we have to consider extrinsic factors such as funding, but also the opportunities in gendered sport environment that may be playing a pivotal role. And of course, there's also other factors to consider that help for health protection of the female athlete. So thinking about things like pre-existing conditions, energy intake, psychological well-being, sleep and recovery, metabolism, and energy and injury risk as well. So I'll give you another example. Even factors in health considerations can change over the lifespan of a female athlete. Things like sleep, where we know that there's a correlation with injury risk. So changes occur over the biological life cycles of menstruation, pregnancy, and menopause. And during times of hormonal change, women are at increased risk for sleep disturbances. And the same goes for pre-existing health conditions. So they may fluctuate along with sex steroids, hormones across the menstrual cycle, but also the life cycle. There are many examples of cyclical variations in health conditions and disease processes. So I'll give you an example of migraine here on this slide that you can see. This also happens with asthma, ATP, cardiovascular disease, metabolic conditions. And these experiences may also play a role in injury risk and our treatment and strategies as a result. So some of the work that we did in our lab was look at cyclical variations in women with asthma, and found that of 194 patients with asthma who came to a tertiary asthma center, 68% of them had changes with menstruation that were somewhat worse, and a further 27% that were a lot worse. And so 95% of patients with menstrual-linked asthma basically had worsened symptoms around menstruation. So sorry, the 22% of them self-identified as women that had menstrual-linked asthma. So we dug into this a little bit more to try to see if even women with asthma experienced just subjective worsening, or we could see objective changes. And we saw that women with menstrual-linked asthma have distinct clinical characteristics. They have more severe asthma, more allergy, higher rates of inflammation-based disease, and more comorbid disease. And we also took a subgroup from that and looked at women with menstrual-linked asthma that have higher systemic inflammation and also show objective phase-related differences in lung function. And when we looked at athletes as well, we saw that basically even women, female athletes, and this was as compared to sedentary women as well, athletes had higher peak flows, which is a measure of lung function, and understandably they would have higher peak flows and lower levels of inflammatory markers, but they still had this menstrual linked variation in peak flow that they weren't aware of previously. So just even considering things that such as inflammation or different metabolic conditions or comorbid disease, how they're interrelated with tendon or joint health. So value add to your research and clinical practice may be to consider the interplay of pre-existing conditions and these cyclical variations. But just to go over the lifespan, there's a lot of different ways that we could do this. We could categorize by health or systems or things like that, or life stages. So I'm just going to briefly provide an overview of what happens through different life stages. Again, considerations of things to think about as you see female athletes at different stages. So we'll talk about childhood and youth years, the adult, and I put it kind of quotes around reproductive years, because as you can imagine, a lot of female athletes may not want to be considered in their reproductive years. Maybe they don't want to have kids. Thinking about pregnancy and postpartum, though, is a really special consideration for female athletes, and also looking at menopause and beyond. And from the children's and youth perspective, I think one of the big main messages here is that getting and keeping girls in sport is good, really good, and that early sports specialization is probably not good. And these are all messages you've probably heard before. But another thing probably not good for girls is a pandemic. There was a report that just came out in Canada, and more than 9 in 10 girls had decreased or halted participation in sport during COVID, which impacts mental, physical, and social health. But 1 in 4 are not committed to return to sport. So in Canada, that means that over 350,000 girls are not returning to sport after the pandemic. So as a clinician, are there ways, or as a researcher, are there ways that you can encourage them to get back into the game? Because I think this is so critical. And part of what this report suggested that is if we involve girls in the design of return to play plans, connect with their motivations, and think about how this plan will impact girls differently, we can create an environment that supports healthy social connections and have these girls come back to the sports that they loved. And during this time as well, during childhood and youth, once they're back in the game, there are a few considerations. So one thing is to really think about the benefits of puberty. So increased flexibility, balance, strong bones. But the associated body changes can take up to 4 years to occur, and that will affect girls' experience potentially in sport. And this happens around age 11. When they get their first period, those can accelerate some changes and it accelerates growth. But if these changes are occurring before age 8, or they haven't shown any sign of appearing after age 15, then it's important for them to see their doctor to check why. And I think it's also important to emphasize nutrition during these peak years, as their bone mineral density and nutritional. Of course, with nutrition, as I mentioned, can be extremely important. And then thinking about role models being important to keep girls in the game, and also a safe sport environment. Adulthood or reproductive years, we've heard about differences in injury rates regarding concussion, hip pain, so on. Acute illness rates are generally the same, but from a physiologic standpoint, the obvious difference is menstruation. So having menstrual cycles is healthy, and athletes excel at all times of their menstrual cycle and in spite of their body changes. So a really important message for women is to embrace the changes, learn to track them as it may help or hinder them, but throughout the month. But in general, people at all different people have reported breaking world records and winning medals at every time during their menstrual cycle. So there's 3 conditions that I want to touch on really quickly to think about, and considerations for women with menstrual cycles. So one is that menorrhagia can occur, that's heavy menstrual bleeding. It's not normal to have pain interfering with function in sport, so they shouldn't be lying in bed in pain instead of being able to go to practice. That isn't normal. They should be able to alleviate most of their symptoms with simple pain relief, but management options for heavy bleeding, menorrhagia should always be offered. So especially thinking about things like iron deficiency as a result. Among Olympic competitors, polycystic ovarian syndrome actually is one of the most frequent causes of menstrual dysfunction. So that can be a reason for fewer periods or anovulation. And you can see some clinical signs of hyperandrogenism, so increased potential some facial hair or acne and so on, and loss of hair, and also the kind of the definitive diagnosis is polycystic ovaries by ultrasound. But many of these women may not need to be treated. It is hyperandrogenism state, but it really, if they want to become pregnant, then that would be where they would seek treatment. Having said all of that, it's really important if they have symptoms to talk to their physician. And then lastly, this concept of amenorrhea that I'm sure is on everyone's radar these days, that loss of menstruation. And we don't know if it has any effect on long-term fertility, but certainly it does during that time, and that they are experiencing that. And one of the things that used to happen 20 years ago or 15 years ago even is that the thought was to treat these women with oral contraceptives in order to preserve their bone mineral density. And now we know that's simply not the case, but there are other novel ways of treating. Again, this would require a visit to the sports medicine physician or general physician or endocrinologist. And the low energy availability and relative energy deficiency in sport, again, are really hot topics, and they have been for a while now for female athlete health because of the negative effects, but also the lack of awareness of female athletes. It still happens to this day that some female athletes feel that they're training hard enough because they finally lost their period, which we just know is not the case. So relative energy deficiency in sport means that this low energy availability disrupts their menstrual cycle, has negative impacts on bone health and performance as well. And this happens in both male and female athletes. It tends to happen more often in women. And some of the risk factors for developing relative energy deficiency in sport, including starting sport-specific training at a young age, certain personality factors like perfectionism, frequent weight cycling, and certain coaching behaviors, including recommendations to lose weight to improve performance. There probably is some kind of individual response and susceptibility to REDS, but it's generally as a result of low energy intake or psychological stress. And if you want good guidelines to look at, of course, Dr. Margot Mountjoy has led this IOC consensus statement on REDS, and you can see that almost every system in the body can be impacted, including metabolic rate, immune system function, and cardiovascular and psychological health. But more important for the athlete, it can affect performance in a variety of ways, and it can be present in any sport or discipline. So if you have an athlete who comes to you with a bone stress injury, for example, don't forget to think about things like low energy availability and relative energy deficiency in sport, and consider referring the athlete to a physician for further workup, lab work, and investigations. In terms of pregnancy and postpartum, and I know some speakers are covering this a little bit, so I won't talk too much in depth, but I will provide a reference in the Twitter account, but also these slides, and welcome to send them to everyone in attendance today, that there are safety precautions and recommendations, but generally it can be safe to continue in sport for a period of time at least. Of course, it depends if it's a high risk or contact or collision sport, but in general, we're thinking the current thought in the research, which has been quite slow, but it's coming along well now, is that it is safe to engage in physical activity, even of a higher intensity, and in sport through much of pregnancy. Studies from our group studying elite athletes in pregnancy, led by Dr. Margie Davenport, have shown that elite athletes return to physical activity early in the postpartum period and sport, and may have an increased risk of injury as a result. So that's one thing to be mindful of. But they do have reduced odds of things like low back pain during their pregnancy, and generally very healthy pregnancies if they continue in sport. And one of the big debates to come out, and this was only less than 10 years ago now, but whether or not there's valid concerns for completing a marathon while pregnant or very specifically close to due date. So there was widespread media attention given to Amber Miller, who was a 27-year-old woman who at 39 weeks of pregnancy gave birth following her completion of the Chicago Marathon in 2011. She completed the marathon in about 6 hours and 25 minutes. And 8 hours after completing it, she gave birth to a healthy baby girl. And really the thought behind how safe it can be is that fetal heart rate is unlikely to be abnormal when maternal heart rate is below 90% of maximum. Blood flow to the uterus and oxygen delivery is minimally affected before the below the ventilatory threshold, and that hypoglycemia is unlikely at that particular marathon pace, as well as exercise generated heat stress. It wasn't too warm. It was less than 20 degrees Celsius for much of it. So this remarkable feat, some people would say it's not a remarkable feat, that this is the way it should be, but really to think about it as proof of concept, not necessarily always proof of safety. But I think as this becomes more normalized in popular media, but also in our research, that we will be able to see how safe continuing physical activity is. And just a quick word on breastfeeding, because this is another thing that we're starting to see. There were these kind of urban myths floating around that if you breastfed your baby after intense exercise, that the baby wouldn't want to, that it would have a sour taste to the milk, or the baby would be too fussy, that not to breastfeed if you're competing. But the WHO does recommend exclusive breastfeeding for at least 6 months, and exercise during this period is safe and does help women resume normal weight. So elite athletes do maybe need to be a little careful they don't lose too much weight, and should compensate with higher energy intake. And they may find that exercise is more comfortable after breastfeeding. And postpartum and motherhood, some just general advice. I know you've heard about this already in terms of mental health, but also thinking about assuming not too much weight loss after pregnancy, and also expecting that, in fact, women after they've become pregnant and delivered, they can expect their VO2 max to return to their pre-pregnancy level or even higher after delivery. So their maximal oxygen uptake can improve, due mostly to new growth of new blood vessels, and higher cardiac output that can linger beyond delivery of a child. And so things, of course, there's musculoskeletal considerations like low back, pelvic girdle pain, or diastasis recti. But again, a good pelvic floor physiotherapist can certainly help in that regard. And to finish off with thinking about menopause, it occurs at many different time points over the course of a career, but generally around the age of 50. And it really is a point in time. It's 12 months without menstruation. It's possible that some athletes may mistake amenorrhea for menopause with relative energy deficiency in sport, or vice versa. But again, this is something that can be figured out fairly simply with good consultation with primary care or a specialty medicine. There are symptoms, of course, that may need to be taken into consideration for these athletes that include hot flashes, mood and sleep disturbance, and thinking about bone mineral density. But high intensity interval training and strength work during perimenopause 4 to 5 years before. It's a great time to start, of course, in that range of when menopause may happen. But it's great to alleviate symptoms, and it can certainly help maintain strength and bone mineral density after menopause as well. Some considerations, of course, is that to think about those specific exercise and heat or sleep disturbances. And then there's a beyond. I love this picture. This is by, if you want to go on Twitter and follow Alex Rodas, she is a lovely photographer of people who are engaged in sport at older age, and is a great advocate for this as well. This concept really of lifelong sport. The body is adaptable and trainable at every stage. Masters athletes' participation is on the rise, and the aging athlete is no more prone to injuries than younger athletes. But we do have to think about considerations, specifically including things about cardiovascular, respiratory, and musculoskeletal systems. But generally speaking, we just have to think about things more about dehydration because they may have a reduced sensation of thirst and less sweat. But also just think about, of course, cardiovascular events, screening them for that. And MSK injuries may take a little bit longer to recover from. And in our lab, we've also looked beyond sports, so things like retired elite athlete health. And I won't, for the purpose of time, dig into this too much, but we looked at Canadian national team rugby players and rowers and found that they were actually doing quite well many years after sport. They had an average age later on of having babies, but they did, even with menstrual cycle irregularities during their career, were able to have healthy pregnancies for the most part. Musculoskeletal health, even though they had injury during sport, similarly reported very good MSK health later on in life. And mental health did seem to ebb and flow a little bit, specifically at the time of transition, but it did bounce back and become better in later years. I just want to leave you with this fact that physical activity and sport can be transformative tools for promoting equity as well. And I know we all know this, but it is one of those things that if we can possibly think about returning these women and girls to sport, help them optimize their physical activity, it would be incredible for even just women's equity at large. So I love this quote by Maya Angelou, to do the best you can until you know better. And then when you know better, do better. And our female athletes of today deserve our attention, our scientific rigor, our data support to achieve their dreams. There's so much powerful physiology to study, so many strengths of the female athlete, and no more time to waste. The ways that data are collected, analyzed, interpreted, and shared can all either reinforce existing inequities or attempt to reverse them. So let's aim to reverse these inequities and forge a better path for female athlete health, so more women get to experience the powerful and life-changing benefits of physical activity and sport. So I'll leave it there. This QR code is if you want to visit our lab website. I'm going to now try to start. Okay, I'm not going to start my video. Not just yet. All right, I might try it. I'll tempt fate here, but
yeah,
I know
try
we
without
probably don't
slides.
have time. Yeah. I know we don't have time for questions, but please feel free to email me at any time, and I'm happy to answer any questions.
Yeah,
thank you for your patience.
Yeah, many thanks, Jane. It was a wonderful overview. So many topics, so many important topics. Maybe if you have a minute, there is just one question from the participants, if you would like to answer. What would be your advice to athletes who tell you that they are happy not having any bleeding anymore because their menstrual pain is gone?
Excellent question. I think that, so one of the most important things is to establish rapport with your athlete, absolutely, and to get on the same page. And where I've had more successful conversations is not to talk about long-term health, because bone mineral density, potential premature osteoporosis, all the health considerations may not actually affect them in that time being where they are focused on their athletic career or an upcoming competition or race. So instead, I start talking about the performance aspects, because it does affect performance. It affects even just how they are feeling from a mental health perspective, but it can also increase injury risk, but also just it's almost like an overtraining syndrome. There's a lot of overlap between that, so it can reduce performance. In the short term, it seems to potentially be okay, or sometimes people report better speed, but more often than not, in the weeks that follow, their performance will decrease. So it's getting on the same page, that realizing that they can't be under fueling. They need to really be looking after their performance as well. And this is part of getting their menstrual cycles back.
Yes, and then a second small question, maybe long answer, I don't know. How are you informing the coaches, for example, of the Canadian Rowing Federation about these topics?
Yeah, it's a great question. We're talking, I'm a new board member. I've been helping with the medical aspects of Rowing Canada here and there over the course of the last several years. But what we have been looking at specifically is how can we optimize the health of lightweight rowers, for example, as well. So I study rowing injuries, MSK rowing injuries. So that's kind of where my specialty is in that realm. But we've recently also started to looking at optimizing lightweight rowing health, because again, there seems to be an increased risk of rib stress injury in that population, and may be related to relative energy deficiency in sport. So it's how can we advocate, provide education and awareness about menstrual cycles, and it's male athletes as well that can have REDs, and that's the same thing in the rowing population. So really advocating for increased awareness and to be approachable, and people can reach out if they have questions. And it seemed to be working well so far.
Excellent. So, and then of course, together, I think we would like to remember all attendees that BGSM is a great resource for many topics. There are blogs and not only research articles, but much material that can be found there. And on these words, exactly. I thank you for your participation. Sorry, we have to stick a little bit to the program, but it was great. It was great to have you with us. And all the best, and hope we see us soon.
Absolutely. Thank you. Enjoy the rest of the conference.
Thanks a lot. Ciao.
Okay. Bye. Ciao.
Ciao.